Welcome to Beyond Rehab Functional Strength Training, the missing link for post-rehab patients. Well, who am I? I am Will Sturgeon. I'm the owner of MB Wellness. I have 3 college degrees. I have 10 years of experience. I'm an NSCA certified personal trainer. I'm also a licensed massage therapist. I hold over 12 certifications, and I'm a former adjunct professor at SMSU. All that to say is I'm somebody who is very qualified to be having this discussion with you. And so, what is it that I do? I help active adults over 40 live their best life by improving their strength, endurance, and mobility without breaking down their bodies. Because let's be honest, as we age, fitness may not always be the best for us if we're not doing it correctly. Now, in this presentation, there are 3 questions I want to ask before I get started. And those questions are, do you have a plan for helping your patients maintain strength after they're discharged? Do you have a trusted functional strength trainer helping your patients post-rehab? And do you have a place where your patients can improve their functional strength? If you're like most people, you answered no to this, which is completely fair because we don't even know that this exists. Now, with these questions, what we can do with them is help answer what is going on with the patient pain cycle. And the patient pain cycle is this. A patient comes to you because they're in pain. You then treat them in some form of capacity with a rehab. They get relief. From there, they stop doing what they were doing to help them get out of pain. They end up re-injuring themselves, and the cycle repeats over from pain to care to relief to not continuing to re-injuring and over. This was a problem I would often see while working in a rehab setting, which led me to open up my first business called Restored Strength, where I help bridge the gap from rehab to strength training. Now, why does the cycle continue? It's oftentimes a lack of accountability to your patients. They don't have a structured training program. They fear re-injuring themselves. They are not making the time for taking care of their bodies. They're in the wrong environment, such as a big gym where they're not given guidance or care. And they might be working with underqualified trainers, which leads to the next issue, which is the gap in the industry. Most trainers are not focused on active adults. Most trainers are focused on building body parts, not functional movements. Trainers are often lacking continuing education. They may not understand the post-rehab needs of your patients, or they're focused on creating sweaty soreness rather than the results that a patient actually needs. And so the real problems that patients have is that they're dealing with tight overactive muscles, they have weak or inactive core and glutes, they have poor joint mobility and flexibility, or they're dealing with high levels of stress, whether it's from work, family, or just day-to-day living. And this is where I've come up with the MB Wellness Solution. The MB Wellness Solution is monthly small group personal training. It's affordable and attention focused, training that builds strength, mobility, and confidence. It's ongoing progression with skills, personalized modifications from a professional. I offer flexible scheduling, but most importantly, community-centered approach where we're bringing individuals together to work on their health together and building our community. And so what a training session usually looks like for us is we start with some type of myofascial release, whether it's foam rolling, maybe it's using a massage tool to help release some of the tension within the muscles, get blood flow to the areas. From there, our warm-up begins with some core activation and breathing drills, which then leads into a dynamic warm-up where we're focusing on movement patterns to help us prepare the body for exercises. Then we begin the session with some type of stability and mobility exercises, specifically core exercises such as dead bugs, glute bridges, side planks, bird dogs. And then we move into the strength training portion, where we're focused on upper body and lower body movement patterns. Then, at the end of the workout, we'll do a cool down that's focused on stretching and breathing. What this is a mind-body educational approach to helping patients understand how their body should be able to move. And so, how can we work together? Well, I would suggest that you identify your best post rehab patients, those who have been consistent, those who are motivated, but those who do have the financial funds to continue on with their care. I can give you an exclusive VIP coupon that you can hand to them. I keep them moving. They sustain the progress with their wellness that you were able to provide for them because your care doesn't end, it evolves with us. And so, who would be the best fit for this is anybody who's 35 to 65, if not older. They've completed their rehab pain free. They want to feel better, not just not hurt. They have the time and the financial resources. They want structure and support, and they care about progression, not just prevention. So let's keep them strong, and let's make sure that the first place to start is pain relief is just their first step. From there, strength is next. Let's keep your patients out of pain and off your table. I appreciate you taking the time to watch this video, and if you have any questions or if you want to know more about what I'm doing, here are the resources you have that you can go and look, and I'm here to help.